to Medical Dialogues. I'm Mr. Zaman and here's what I bring to you all from the world of medicine. Study finds neoadjuvant nivolumab to show long-term benefits in patients with non-small cell lung cancer. Patients with resectable non-small cell lung cancer or NSCLC who were treated with neoadjuvant nivolumab had improved 5-year recurrence-free and overall survival rates compared with historical outcomes, according to a recent study published in the journal Clinical Cancer Research. Among the 20 patients who underwent surgical resection, 12 patients, that is 60%, remained recurrence-free 5 years after surgery, and 16 patients, that is 80%, were alive, exceeding the 36 to 68% 5-year survival rate historically observed for patients with stage 1 to 3rd non-small cell lung carcinoma, the authors noted. They added that the observed patient outcomes after neoadjuvant nivolumab were better than those historically observed among patients treated with neoadjuvant chemotherapy. Atherosclerosis risk in older adults negatively impacted by irregular sleeping habits, finds study. Sleeping an inconsistent number of hours each night and falling asleep at different times may increase the risk of developing atherosclerosis among adults older than 45 compared to people with more consistent sleep habits, according to the latest research. Atherosclerosis is the buildup of fatty deposits known as plaque on the artery walls. The plaque can cause the arteries to narrow, reducing blood flow and the amount of oxygen and other nutrients reaching the body. Or the plaque may burst and create a blood clot that blocks the artery, which could lead to a heart attack or stroke, according to American Heart Association health information. Study shows women's greater risk of dementia may be linked to disadvantage. A large international study of dementia risk involving almost 30,000 people from 18 countries covering all 6 continents suggests that social and economic disadvantage may explain the higher risk of the condition in women. Although there was almost no evidence of sex differences in most of the known risk factors for developing dementia, the higher likelihood of women developing the condition was more pronounced in poorer countries. Rates of dementia are increasing most rapidly in low and middle income countries, that is LMICs, that are less able to manage the significant economic and societal impact of this devastating disease. In 2020, the Lancet Commission report estimated that as much as 40% of dementia risk could be attributed to 12 modifiable risk factors, many of which are more common in LMICs. They include less education, hypertension, obesity, diabetes, depression, hearing impairment, smoking, excessive alcohol consumption, physical inactivity, low social contact, traumatic brain injury, and air pollution. Patients with fatty liver disease can improve health by alternate day fasting, finds study. Nutrition researchers at the University of Illinois, Chicago studied 80 people with non-alcoholic fatty liver disease and found that those who followed an alternate day fasting diet and exercised were able to improve their health. The researchers report that over a period of 3 months, people who exercised and alternated feast and fast days, that is eating without restriction one day and eating 500 calories or less the next, saw increased insulin sensitivity and decreased liver fat, weight, and ALT or alanine transaminase enzymes, which are markers for liver disease. Non-alcoholic fatty liver disease is a buildup of fat and inflammation in patients who drink little to no alcohol. Approximately 65% of obese adults have the disease, and this condition is strongly related to the development of insulin resistance and type 2 diabetes. If left unchecked, fatty liver disease can lead to more serious complications like cirrhosis or liver failure. But there are limited good drug options for treating the condition. That's all for today. Stay tuned to Medical Dialogues for latest updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.